Thank you, sir, for sharing all these moments.
Oh, so I thought you were going to give me a hand.
Thank you.
Once I thought taking medicine was a biggest mistake in my life. Now it is bringing a lot of miracles to me, a lot of success and a lot of acceptance to me. So now I'm happy with my parents' decision, not my decision. This question is making me uncomfortable.
Give us tip how I can become humble, my audience become humble.
I don't know. I don't have any secret recipe for this.
Okay, let's move.
Just try to be humble as far as you can. That will do.
Hello everyone. Welcome to the next episode of Unseen Podcast with Nilesh. Today I have with me Dr. Ilongwan sir, Assistant Professor of Pathology in Government Medical College, Kannur. Hello sir, how are you?
I'm fine. Hi Nilesh, how are you?
Good sir, good.
I'm seeing an Unseen podcast. It is going very well.
Thank you.
All the best for the future podcast.
Thank you. Can you tell our audience little bit about pathology?
Well, pathology is a science. It is a branch of medicine which deals with the study of diseases. And pathologists are also doctors, and they have a specific set of skills to interpret the cytological changes or cellular changes that are occurring due to diseases. And with their knowledge, they will make some informed decisions, and those informed decisions are known as diagnosis. And in certain cases and in applicable cases, this diagnosis will play an important role in making patient treatment protocol. Right? So I'm saying this in certain cases and applicable cases because not all the diseases require histopathological or cytological support. For example, in case of myocardial infarction, it can be diagnosed with electrocardiogram and with serological assays. In case of stroke, it can be diagnosed with radiology. And but the tumors, malignancies can be diagnosed, can be confirmed only with the help of pathological support, a morphological analysis. So that's the role of pathology in modern medicine. And in fact, modern medicine has evolved along with pathology. Okay. Before the evolution of pathology, the medicine was related to it was like a symptom-based treatment. Okay, medicine was like a symptom-based treatment. So with the evolution of treatment, the paradigm has shifted from the symptom-based treatment to cause-based treatment. Okay, so knowing the cause of the diseases is a part of pathology. Right? So if you know the underlying pathology means we can successfully intervene the disease. If we intervene the evolutionary process of the disease means we can control the disease. Right? So that is pathology, and I am pathologist.
I think all the students got the answer. What pathologists do?
Okay, thank
Can
you.
you tell me about how did you come into medicine? Why did you choose pathology as your specialty?
Well, actually, medicine was not my first choice after my 12th standard. I had other options, but because of my parental influence, and that was a big story. Because of my parental influence, I got into the medicine. Okay, even during the time of counseling, in front of counseling hall, I was weeping. I was crying in front of the hall, and I was saying to my parents that I won't be taking the medicine. I want to become a automobile engineering or engineer or aeronautical engineer. But they blackmailed me and they pushed me into the counseling hall and made me to sign in the admission form, and I got into the medicine. So it was like a forced arranged marriage. Right? So I had a convenience that whenever I felt something low, I used to call my parents and I will complain. It's all because of it was all because of you, like that. So that kind of convenience was there. But that was the scenario how I got into MBBS.
And how did you come into pathology?
Okay, pathology. Regarding pathology, after completing my house surgery, I think in May 2010. I joined in an entrance coaching, and then within 6 months of training, I got a rank in All India entrance. And then during first counseling, I got into diploma anesthesia. and then in the second counseling it got upgraded as MD Pathology in Calicut Medical College. Okay. For the time, for admission purpose, I went to the college and I liked the atmosphere very much. I saw the HOD there. Then Dr. Sadi PP was the HOD. I saw her. I interacted her. I liked her very much. I liked the environment. And then again, I went to the third counseling. And during the third counseling, I got MD anesthesia in North India. But my heart said that you must go to Calicut Medical College and pursue pathology. So I ignored MD anesthesia and I joined MD Pathology, and it was a great thing. It was a great decision in my life.
Are you happy with your that 12th decision of taking medicine?
All right, that's a good question. Sometimes the things you consider as mistakes can bring miracles to your life, right? So once I thought taking medicine was a biggest mistake in my life. Now it is bringing a lot of miracles to me, a lot of success and a lot of acceptance to me. So now I'm happy with my parents' decision, not my decision.
You are so successful. You don't have any ego. Can you tell me also how I can become like that?
Oh, that's
Because I ask you for podcast, you accept proposal within a second.
How can I answer this question?
No, every student like you. Means that if I talk about you, every student like you, your simplicity. Every student talk about that.
Wait,
So give us
this question is making me uncomfortable.
give us tip how I can become humble. My audience become humble.
I don't know. I don't know. I don't have any secret recipe for this.
Okay, let's move.
Just try to be humble as far as you can. That will do.
What are the pros and cons of choosing pathology as your specialty?
Being a pathologist, the first one is we can have a predictable working schedule. Right? There won't be any emergency calls during our off time. Okay, we can properly plan our non-working hours, and we can have a proper work-life balance.
Okay.
Right? And the second thing is it is an intellectually challenging subject. Right? So we have to. So it's a kind of puzzle. Okay, with a lot of information from the clinicians and from the microscopes, and we have to solve a puzzle, and it's a kind of fun for me. Those are the pros of being a pathologist. And regarding cons of pathologist, it is there won't be much patient interaction.
Okay.
The patient interaction will be very minimal in pathologist, and most of the individuals don't know who is pathologist and what they are doing and what is their contribution to their healthcare. They will receive pathology report and they will benefit out of those reports, but they don't know what is the role of pathologist or pathology in their treatment. Okay, so that kind of recognition is lacking in pathology. Okay, that's a slight. What I can say, that's a kind of slight disappointment in me with pathology.
That even though pathology is not a direct clinical branch, but how it contributes to patient care?
As I have already mentioned, pathology is a crucial part of modern medicine. Pathology is one of the, it can be considered as the highest evidence of modern medicine. So we can consider pathological evidence. There are different forms of pathological evidence. It can be a morphological evidence. In morphological evidence, there's histomorphological evidence, cytomorphological evidence, so on so. And similarly, genetic evidences are also a part of pathology. Right, and with the help of protein expression, we will gather some information. So using these information and from the clinical data, we will make an informed decision, right, an intellectual decision, and those decisions will become a diagnosis, and that will form a pivotal point in the patient's treatment decisions.
Yes.
Okay, right. So if we ignore pathology, if we ignore pathology from the modern medicine, means then we will go back to quackery. Right? So we'll be treating the individuals with based on their symptoms, not based on the diseases. So we'll be treating the individuals based on their presentations, okay, not based on the exact problems.
Oh.
Right? So pathology can be considered as a foundational principle for the evolution of modern medicine, and it is one of the highest evidence of modern medicine. There are different kinds of evidences. Radiological evidences are there, serological evidences are there. Pathology primarily is concerned about morphological evidences, the protein expression by the cells, and the molecular data within the cell. Molecular data means the genetic content within the cell. So all those things will contribute to the treatment.
What is the most unusual or rare case you encountered in your career?
Unusual case. A few months back, uh, I diagnosed amoebic colitis. Okay, and it was not suspected by the clinician. And for them, it was an inflammatory bowel disease. And they requested me to make more serial sections. During the initial sections, there wasn't much information, but with subsequent sections, I got only 2 amoebas.
Okay.
I got only 2 amoebas. Luckily, it got under my microscope, and I pick it up, and then I made a diagnosis of amoebic colitis. So that the individual can be treated with antimicrobial, right? So then then one more case was the interesting case. So recently I had diagnosed a papillary thyroid carcinoma. It's not a papillary thyroid carcinoma, it is a papillary microcarcinoma of thyroid. So can you guess the dimension of the papillary microcarcinomas? Should be less than 1 centimeter.
Okay.
Okay, I diagnosed a papillary microcarcinoma of thyroid, and the dimension of that neoplasm is 0.3 millimeter.
So less.
0.3 millimeter. Okay, it was a microscopic tumor, right? So all these things are few interesting cases that I encountered recently, and these sort of things will make me happy, and these sort of things will make me this is why I'm a pathologist.
Sir, in your opinion, why do many students hesitate to choose pathology as their super specialty?
First thing is their bitter experiences during second year pathology. Because they are very much afraid about the pathology. The pathology means they will read about the etiology, pathogenesis. They can read about etiology, pathogenesis, but the horror part in pathology is gross pathology and microscopic pathology. Right? Am I right? Yeah. The toughest part in pathology is gross and microscopic pathological features. So those are the parts in which students struggle. Okay, so that negative experience may influence their decision making, but there are many students who are genuinely interested in pathology, and they wanted to pursue their career in pathology, and they opt pathology as their primary choice during PG counseling.
Sir, what are the super specialty options after MD Pathology?
So after MD Pathology, there are a lot of post PDCC courses. Okay, PDCC courses means that they are postdoctoral certificate courses. So such as nephropathology, oncopathology, molecular pathology, neuropathology, and then we have few DM options also. DM oncopathology and DM hematopathologies are also available in I think in AIMS and PG. DM histopathology is also available in some central institutes.
Sir, after finishing MD Pathology, what would you recommend? Doing super specialty or doing a fellowship course?
When I was a beginner, there were a lot of opportunities
Okay.
in pathology, right? So in the current situation, I would recommend a fresher to go for a PDCC or fellowship courses. Okay, so that they will get trained in a particular stream and they can practice that particular stream, and they can have a more solid knowledge about a particular stream, and they can make their voice heard. Okay, but I prefer to be a general pathologist because I like the heterogeneity in pathology.
Sir, how much a pathologist can earn in India, both in government and private setup for beginners
So for beginners, currently they'll be paid around 80,000 to 1 lakh per month
in government colleges?
everywhere. On
Okay.
average, they'll be paid 80,000 to 1 lakh, and depending on their potential, they can scale up.
Okay.
Okay, so when I started my career, I was appointed for 68,000 rupees, 69,000 rupees, and I had an opportunity to scale it up to 1 lakh, but I denied it. And to maintain my harmony, to maintain my work-life balance, I denied the private opportunities, and I only focused on medical college works. And then at present, I'm happy.
Sir, how is AI is being currently used in the field of pathology?
I believe that it will bring a significant transformation in pathology diagnosis.
Okay.
Right? So let me share you my personal experience. Few days back, I shot a histopathological image of a common skin condition, and then I fed it to Chat GPT, and it made the diagnosis. It made the exactly correct diagnosis. Okay, with few possible remote possible differential diagnosis. And I wondered. And then my senior sir, he sent me few pictures, and that was a bit tougher case. And again, I fed it to ChatGPT, and it gave a beautiful differential diagnosis. And how we can solve the problem also, it suggested it addressed the problem, and then it suggested the solutions also.
Oh.
Okay, so a super smart working assistant, a super smart chatbot like Chat GPT can make a diagnosis. Means there are few pathological AI model. Okay, there are few AI models that are designed for the purpose of making pathology diagnosis. Okay, so they can make accurate diagnosis.
Oh.
They can make precise diagnosis. They can predict the outcome of the disease based on the morphology, based on the pattern they are picking up the diagnosis.
Okay.
Right. So in future they will definitely going to assist pathologists in making diagnosis. Okay, in some cases they can replace pathologists. Okay, replace means they won't directly replace pathology, or they won't directly sign out pathological report. Just imagine this scenario. I am working in a pathology lab,
Okay.
and you are also a pathologist in the same lab.
Okay.
And I can, without the help of AI, I can report 10 cases per day. And you are also reporting 10 cases per day.
Okay.
But the sample load is 30.
Yes.
Okay, that means ideally we need
Three
3
pathologists.
pathologists. Okay, but with the help of AI, if I can diagnose, if I can make 16 diagnoses, and if you can make 15 diagnoses, means
Okay.
what can we do? What will be the number?
30, 31 will be.
30. So the workflow will improve. The efficiency of pathologist will improve. The turnaround time will decrease. Okay. So what will happen to that scope? What will happen to the third pathologist? Will he get the job?
No.
No. Will he get?
No.
Will the management appoint an extra pathologist?
No.
No. It's not possible, no? So by improving the workflow, by improving the efficiency of pathologists, AI will hinder the job opportunity of pathologists. It won't directly replace the pathologist, but it will definitely hinder the job opportunities of pathologists.
Later he can replace one also, two also.
in future, later it depends on the model, it depends on the accuracy, and it depends on the researchers. So if researchers claim that AI models are superior than pathologists in predicting diseases and predicting the outcome, means then gradually pathologists will be replaced by AI, but the possibilities are very remote.
Hmm.
So pathologist contributions will be needed, but the job opportunities will be lessened by
Workload will
by
be
the
decreased
influence
little bit.
by the influence of AI. The job opportunities will become less.
Okay. Sir, many students think that pathology is just lab reports and microscope.
Hmm.
But what you tell that to new student that pathology is not like that?
I used to say this to my students during my practical classes, that whatever you're doing in practical pathology is not just another practical session. It's the you are having a unique experience without your knowledge. The unique experience is, this is the only place in the practical hall, pathology practical hall is the only place where you can see the disease with your eyes,
Okay.
either with the help of microscope or with the naked eyes as gross specimens. Okay, so this is the only place where we can see the diseases.
Okay.
There is no speculations. In clinical sites, if you go to the clinical sites, means you will be framing differential diagnosis. Those differential diagnoses are nothing but they are speculations. They are assumptions of clinicians.
Okay.
They are assumptions of the students, but not the exact diagnosis. But in practical hall, in pathology practical hall, what you are seeing is the disease. So after moving out of pathology, you cannot see the disease.
Okay.
You cannot read the disease. You can only make speculations or assumptions.
Yes.
Okay, so pathology is not just about microscope.
Okay.
It's more than that.
Sir, we will take one question sent by student.
Hmm.
What is the job scope in transfusion medicine and what are the opportunities for further education in the field? Also, could you shed some light on forensic pathology as a career path?
I have very limited knowledge about transfusion medicine and forensic pathology, but I can share some points. The thing is, transfusion medicine is a relatively newer specialty in India.
Okay.
Okay, and the demand is also very high.
Okay.
If an individual completes his or her transfusion medicine degree, means he will be readily hired for higher salary.
Yes.
Okay, and they are the individuals responsible for safe blood transfusions.
Okay.
Okay, they will maintain the quality in blood bank.
Okay.
Okay, and they have enough job opportunities in blood bank. They can be hired in private hospitals. They can be hired in labs, and they can also take part in research. And they can get into NACO, National AIDS Control Organization,
Okay.
and then drug controller of Government of India. So they can be employed in these agencies.
Okay.
And so these are the job opportunities available for post transfusion medicine individuals.
Okay.
Hmm.
Sir, before we wind up, we'll do one rapid fire round.
Rapid fire.
Okay.
Okay.
You have to give quick answer.
Quick answers. Okay. Yeah.
In short.
In short,
Sir, if you are not in medical profession, what you will be doing?
I had already said, I will be pursuing some engineering, either automobile or aeronautical, and somewhere I'll be dealing with screwdrivers and computers and so on. So I don't know.
Sir, what's your favorite hobby?
My favorite hobby at present is photography and photo editing. Then I will cook. Cooking is also my favorite.
I also love cooking.
Nice.
Your all-time favorite movie?
My all-time favorite movie, it's a Tamil movie known as Super Deluxe. Super Deluxe.
Okay.
I recommend this movie for audience.
What's your favorite food?
My favorite food, there's a lot. What should I can say it as tawa fry. Prawns tawa fry from Calicut Paragon District.
Okay.
That's my favorite thing. There are a lot of things, but I choose this one.
Any book you want to recommend to students?
Two books. One is Masala Lab. Masala Lab. It is about the science behind cooking.
Okay.
It's a fantastic book. So after reading the book, my passion towards the cooking has improved. It has enhanced. I am investing a lot of time in cooking now. I am experimenting with cooking, and it is turning out very well. And so I recommend Masala Lab by the author's name is Krish Ashok, right? And and the second book is, I think this book has transformed me a lot. And the first book was recommended by Dr. Raki,
Okay.
my colleague.
Yeah.
Dr. Raki Ramachandran. She recommended me that book, and she introduced that person's Instagram channel to me. And then after seeing his Instagram channel, I was impressed by his way of speech, and then and the content and his contents, and then I brought the book and I read it in 3 days.
Okay.
I read it in 3 days, just 3 days. It's about 250 to 300 pages book. I read it in 3 days. Such an awesome book it was.
Okay.
And the second one is the 40 Rules of Love. Okay, 40 Rules of Love. That one I recently read the book, and that was recommended by Dr. Danish. Dr. Danish was my BDS student.
Okay.
He's a friend of mine. So he's still in contact with me, and he used to recommend few books. And one of that book was 40 Rules of Love.
Oh.
And that book is simply amazing.
Sir, what has been the happiest moment of your life so far?
So at this moment, this is the most happiest moment in my life, because I am delivering. I am in my first podcast with my student, and I am talking about pathology and some other things also. And I am so happy with this podcast and how the things are developing and progressing. And I'm happy for you.
Thank you.
And
Sir.
thank you for having me here.
Thank you. Sir, one advice you want to give to all students?
Who am I to give advice to students? One advice is, you have to study well,
Okay.
and then you have to enjoy your college life, and then you have to have a right balance between them.
Okay.
Okay, you should study well as you should enjoy your
Life.
college life.
Okay.
You focus on your health.
Okay.
Okay, your health, your studies, your mental stability, everything is the important.
Okay.
Okay, preserve your health. That's the important advice I can give you.
Thank you, sir, for sharing all these moments.
Oh, so I thought you were going to give me a hand.
Thank you.